Let's now talk health. Today is the International Day of Action for Women's Health. It is marked worldwide to promote women's rights to privacy, education, and control over their sexual and reproductive health. And Senior Technical Advisor, Pathfinder Nigeria, Dr. Sakina Bello, joins me to speak on the commemoration of the International Day of Action for Women's Health. Good to have you join us.
Thank you very much for having me.
So the focus or the theme for this year is mobilizing in critical times of threats and opportunities. I think I sort of just focus on the critical times. How critical?
So honestly, it's a very, very critical time, because as you know, Nigeria is the second most populous nation in the world, with women of reproductive age accounting for over 46% of the total population. We still have the highest maternal mortality rates globally. And many women in Nigeria, especially those in the rural areas, face barriers to accessing healthcare facilities, either due to distance or due to cost or other issues, maybe the sociocultural norms. Malnutrition is everywhere. It's affecting women and, indirectly affecting the quality of children they give birth to. We have dilapidated infrastructure. We have inadequate human resources for health. And there's a huge funding gap, in actually implementing the policies and the programs that we have in the country. However, behind the numbers, there are real stories, there are struggles, but we are also a resilient nation. And I see a light at the end of the tunnel. Nothing is insurmountable.
And I like that you mentioned that behind the numbers, there are real stories, because when we talk about these issues, it does look like it flies over some people's head, whereas it is a reality for other people. But you mentioned the barriers. Whose responsibility is it to ensure that these barriers are minimized and that women can have access to these facilities?
So I would say it's a collective responsibility. The government have their role. We as individuals also have our role. So it's a collective effort. And I believe, with accountability, both of the government and the individual, we can collectively come together and, go behind all these challenges that I have mentioned.
Dr. Sakina Bello, I know this is not just a one-day conversation. This conversation has to continue. So thank you so much for your time. Senior Technical Advisor, Pathfinder Nigeria, Dr. Sakina Bello.